chart? Okay. Ladies and gentlemen, I would first like to start by showing the proposition what a need for a reform of a healthcare system really should consist of. The need for a change of a complete system, a 100% change of a complete system, should not be the corruption of the pharmaceutical companies. The need should not be overcharging of the current system. That should not be your need. And that brings me on to my first clash, which is the need, and which system caters to the need more appropriately. And we strongly believe that it is our system and our policy. My second clash is which system preserves and maintains high-level quality healthcare. We believe it is our policy. And my third clash today is which system really uses a better avenue of collecting the funds for this change. We very strongly believe it is our policy. Now, ladies and gentlemen, first things first. The need which was established by today's proposition. Now, the proposition came up here, and it talks about with this need of 95% are paying for themselves, and that's really bad apparently, and that pharmaceutical companies are being corrupt, and that we're trying to remove discrimination, something that came about in the third speaker's speech. Now, I will address all of these problems. Now, ladies and gentlemen, I would first like to start off by giving you an analysis that maybe team proposition here might be able to understand. Ladies and gentlemen, when your people are being able to afford expensive toys, the government should not intervene and say, I will give you all free toys. That is not the government's burden. Maybe the government should address problems that curtail to it. Maybe the government should address problems that really require and need this attention instead of unnecessary burdens that the government of this side of the house is trying to propose. Ladies and gentlemen, the government may want to give everyone cheap and good quality healthcare, but sometimes there's a difference between what a government wants to do and what a government should and needs to do. And just because you think you want to give the rich people cheaper healthcare at the expense of charities as your venue, clearly that sentence shows you what is fundamentally wrong with your policy. Yes, sir.
Do you not understand the difference between toys and basic healthcare?
Ladies and gentlemen, we understand the difference between toys and basic healthcare. What you are not understanding is the difference between a government and a perfect 100% reform to deal with a problem that doesn't need that. What we're saying today is that 95% are being overcharged, so we're going to tell charities to fund this 95% of people when these 95% fundamentally don't need this funding. That is what we're saying today. That analysis was totally misconstrued, and that is the only thing you have to say to that. Kudos to you. Now, this brings me on to their second need, how pharmaceutical companies are basically they're pressurizing doctors. How are pharmaceutical companies not pressurizing doctors in your view? And if that is the problem, we believe not in 100% change and not in 100% overburdening of the government. We believe in a stronger maybe FDA regulation. We believe in maybe a stronger stringent controls of the pharmaceutical companies, not 100% reform of the healthcare system today. Please sit down, sir. Now then they came up and talked about their need of undue pressure on the doctors. Now I believe my second speaker very nicely tackled that, but let me again remind you what doctors entail. These are what their system is going to say and how this compromises on your quality. What you're saying is you're creating jobs. How are you going to create jobs in a time frame which I haven't even mentioned? To create jobs and to create doctors and to bring in doctors, sir, your health demand is not going down. Your demand is staying the same. What you're doing is you're changing supply. You're making supply come out of inadequate, untrained, basically unprofessional medical doctors, and that's something that this side of the house will not stand for. Because what do you have when you have a sudden influx of doctors that haven't been trained through the adequate training? What do you have then? You have a compromise on quality, something I will deal further on in my second clash. And then they had their sudden need, which popped up in the third prop sir, about removing discrimination. You really think the fact that you want to change 100%, you want to change a system of private, you want to ban every single private healthcare organization. Your reason for that is removing the disparity between the rich and poor. Is that really it? Sir, how do you justify overburdening charities, something that's not government by the way, overburdening charities, how do you justify overburdening a government and an economy that is just coming back from recession because the rich are paying too much? How do you justify that? Something we do not understand.
Madam,
yes, sir.
Do you not understand that we are overburdening charities who are seeking their support along with taxation, along with the appropriation?
Sir, the support that the charities are willing to give is even there today. This support, if not enough for the 5%, which is a fundamental need, how is it enough for 100% of people? 95% of people which don't even need this support, I afford. Why put this undue burden on the government? Why put this undue force on the charity, which are doing their job in the current model, which will be doing their job in our policy, something that's simply not required. Thank you, sir. Now, their final need was that people are being overcharged. Now, sir, let me tell you something. Right now, the fact that people are being overcharged, no one is forcing this money out of them. They're willing to pay this money. What you're doing today in your model, you're taking away the right to choose. And the second speaker actually has the audacity to come up here and say they have the right to choose because they have the right to choose to go out of the country and seek medical health care there. That's what the second speaker came up and said. Sir, the right to choose, sit down. The right to choose is fundamental here because what you're doing is you're telling 90%, 5% of the people that you will have to resort to lower healthcare system even though you could afford the better healthcare. That's what you're telling your people. You're telling 95% of your population that the government wanted to help all of you, so we're giving you lower quality healthcare system. That's what you're telling your population. Something, by the way, your population, the rich, will not stand for. Sit down, sir. Now this brings me on to my second clash, and this shows you how the need in their model doesn't exist, and if the need is to make the 5% lives better, we are doing that in our model. We are doing that in our model, and we are only putting the need and the burden on the government that the government deserves to have, and that the government, that the pressure that is necessary. I highlight, not necessary, not overcharging of people who can afford this overcharging. Please don't. Now this brings me on to my second clash about quality. Now, they wanted to create jobs. Their need fundamentally was also to create jobs. And they said how the government's not pressurized and it's not overburdened because charities in their model are helping the government out. Sir, relying on the Bill Gates Foundation for 100% reform, again, is not going to work. It is simply